I want to talk about standard wipes, not ostomy wipes, but plain old standard wipes. And the reason why I want to talk about it is because someone asked me if that wipe hindered my barrier or my flange or my wafer from sticking to me. But first, I am not a medical professional. Everything I share in these videos are coming from my own personal experience. For some people, maybe standard wipes do cause an adhesion problem, but for me, the wipes that I'm using, they do not. What works for one person may not work for another person. So I want to show you all the wipes that I use, and show them to you again, and talk about why I use them, and then talk about why they work. So the first of all, the wipes that I use are these standard adult extra large wipes. And that's one of the reasons why I like it, because they're extra large. I am not, this is not a paid promotion. This is because this is what I use and this is what I like. So the reason why I like them, first of all, is because they're super big. Let me show you that. They're super big, and I want to be able to put this around my stoma after I remove my bag, and I want to wipe the area and remove all of the residue and any output that could still be on my skin after I have removed my bag. I also have my adhesive remover spray that I use when I am taking my bag off. Now, after I have used the wipe, I sometimes will spray this and go over it again. But the reason why the wipes work for me is because after I have used it, my skin is having an opportunity to dry. And then, oh, and before I share that, let me show you what the adhesive remover wipe is. So I want more than this when I'm removing the residue and the extra output that may be on my skin. I need something bigger than this. So that's why I use it. But after I have used the wipe, then I'm going to follow up with, this is also small, but this is the skin barrier wipe. So this wipe is going to go around my stoma, the skin around my stoma, and it's a little sticky, right? So that's part of the adhesion and barrier right there. Then after I have done that, I'm going to apply my barrier ring. And this barrier ring is absolutely sticky. See how I have to pull my fingers back when I do it? So this is sticky. So once I have placed this around my stoma, all of this part is on my skin where I initially wiped when I was using the wipe. Okay? So even around further where the flange is going to go, that space has already dried. So when I put on my flange or my wafer or my barrier, whichever one you like to call it, once I place that on, it's going to adhere to my body and I'm not going to have any issues. So that's why I use the wipe. And I'm not saying or suggesting that you use it. I'm always going to suggest that you talk to your stoma nurse or your medical provider before using anything. I'm not encouraging that. I was just sharing what I do and what works for me. So I really felt like I needed to clear that up. And for anybody that's trying to gain some understanding, especially if you're a new ostomate, around the products that I use or products you should use, I'm going to always advise that you speak with your stoma nurse and your medical providers before you use any product. I have encouraged the deodorizing lubricant, but that's because the deodorizing lubricant does not come directly in contact with the skin, and it's inside the bag. But I'm speaking of things that have to go directly on your skin. But Sandra is absolutely fine with these wipes. They work wonderfully, and I just want something big that I can wipe around, and that's just my thing. However, I never had a problem with my barrier, my wafer, my flange sticking to me. And of course, if using a wipe would have caused that, then I wouldn't use it anymore. So, but that's my thing. That's the reason why I use the wipes. It's not a paid promotion. It's just something that I absolutely love, and it absolutely works for me. So, with that, again, follow up with your care providers and your stoma nurse before you use any product. It doesn't matter if it's a barrier ring or if it's a wafer or if it's a adhesive remover spray. Whatever it is, always check with your providers first. And I really want to thank you all for watching. Thank you for showing up once again. If you have an opportunity, like, share, and subscribe. I would love to see more of you and have more engagement with you. And I will see you in the next video.